Welcome everyone and good morning. I'm Dr. Jason Martin, and today I'm joined by dozens of my fellow physicians on behalf of more than 75,000 colleagues and many medical societies across Tennessee. We first began pleading with Governor Lee back on July the 6th, 165 days ago, to take action on COVID-19. We have asked for a statewide mask mandate and other interventions so that Tennesseans can safely stay at work, provide for their families, and keep their kids in school, and most importantly, to save lives. Governor Lee, we come together today speaking with one voice to tell you that we are alarmed by what we see unfolding in Tennessee. We see wildly increasing case counts, a healthcare system stretched to its limits, and record hospitalizations and deaths among our fellow Tennesseans. Governor, you said yesterday that the medical community is divided about what to do. Well, we, along with 75,000 other physicians and healthcare workers, want to deliver one simple message. Governor Lee, your medical community is not divided in the great state of Tennessee. Governor Lee, we know a thing or two about oaths. We all took one at the beginning of our careers. You too, sir, took an oath. In abdicating your responsibility to protect the health and well-being of your people, you have neglected that oath and abandoned the people you were elected to serve. For months, health experts here in Tennessee, along with the White House COVID-19 task force, have pleaded for your action. And instead, you have shifted the burden of leadership, the burden of managing a global pandemic, to the mayors, teachers, local business owners, and parents of Tennessee. Governor Lee, you've said time and time again that the only way to manage this crisis is through personal responsibility. But where, sir, is your responsibility in this matter? While business owners and teachers and parents and children and first responders and healthcare workers are all doing their parts, we need you to do your part, sir. We need you to lead right now. In Tennessee, we value not only personal liberty, but also a commitment to our neighbors. We are the volunteer state, and in times of great crisis, we all pitch in to help. In this, the great crisis of our time, your fend for yourself approach has failed by every metric. The people of Tennessee deserve better. They deserve a leader who's going to represent their values. We ask you, sir, stand up and lead now. Dr. Smith.
Thank you, Jason. Good morning. My name is Dr. Calvin Smith. This week, our home state of Tennessee ranked first in the nation in new cases, and we've now become the leading epicenter for the COVID-19 crisis in our country. COVID hospitalizations are at an all-time high, with 5% of hospital beds available in Davidson County and 10% available in the Middle Tennessee area in general. This is unprecedented and unsustainable. As of yesterday, ICUs are operating at near capacity throughout the entire Middle Tennessee area, with only 6% available. This leaves very little room for those who suddenly become critically ill for other reasons. COVID deaths in Tennessee hit a record high of 177 deaths recorded on Thursday, and 8 new deaths yesterday in Davidson County. Rural Tennessee, where mask mandates are not in place, is suffering worse than the larger metro areas where mandates exist. Moreover, counties that have worked hard to do their part and require the usage of masks are seeing erosion in their progress, and as a result, hospitals are overfilled from counties that continue to let others endanger their citizens by refusing masks. We have seen an entirely avoidable increase in cases of COVID-19, which has resulted in a prolonged closure of schools and businesses, as well as an entirely avoidable increase in hospitalizations and deaths. And now our hospitals and healthcare workers have been pushed to the brink, to the point where patients are being redirected to other states and waiting hours for care, and are waiting for equipment that might not be available. Tennessee has failed to manage this crisis, and people are getting hurt and dying because of it. And this was entirely avoidable. Dr. Millstone.
Governor Lee, you said yesterday that no one could have imagined the Thanksgiving surge that is now endangering the lives of so many Tennesseans. We did, and we've been warning you every day for the last 165 days. As physicians, we each took an oath to protect our patients, much like your oath to lead and protect our state. Governor Lee, your medical community is united. We are pleading with you, work with us. Help us get the COVID crisis under control so that more businesses can stay open, schools can safely resume, and so that fewer Tennesseans will suffer or die. To this end, we, the physicians of your state, have 3 demands. First, issue an immediate mask mandate. It works. Counties with them are doing better than those that don't. Also, counties that have no mask mandates are undermining the progress of those that do and crushing our hospital capacity. Secondly, make the Tennessee Pledge actually protect the public by requiring employers to have safety measures in place to keep people physically distanced and separated by 6 feet and to wear a mask. The public needs confidence that the businesses and schools that they are visiting are doing everything possible to keep them safe. And thirdly, make sure our schools and our businesses who need support stay afloat in this crisis and get the support that they need. You, sir, have repeatedly told Tennesseans that they have a personal responsibility to live up to in this crisis. Governor Lee, so do you. Thank you.
Thank you to everyone who has been able to participate in this. Most of the physicians on the line are currently treating patients and juggling a lot right now. So we're going to go ahead and close and not do the Q&A like we usually do. But we realize there may be a lot of interest in follow-up. So if you'd like an interview with one of the physicians or someone maybe from your part of the state, please reach out to us and we can coordinate some of those follow-ups when they've got some time available later today. Thank you all so much.
Thank you.